Hey, Dr. Ben Schurhamer here. Just a quick primer on how to read your prostate biopsy results. After you get your prostate biopsy, I know it's a scary process, and you will get a notification through your chart that your biopsy results are in your chart. If you choose to look at your results, you can go through this video, and it will help give you a primer on how to interpret what you're seeing. If you're a patient on active surveillance, this may be comfortable for you, but if this is your first time getting a biopsy and first time getting a biopsy results, seeing these different words can be very scary. So this is a sample report from here at Penn, and what you find here are the letters A through G corresponding to the different cores that were taken. So typically we take between 2 and 3 samples per site. And what this sample report here, it's not a real patient, but is kind of how exactly all of our reports are formatted, is that in the right mid there was Gleason 6 disease, and in the MRI lesion of interest there was Gleason 4+3 disease, and in the summary of additional features there was perineal invasion, cribriform pattern, and no intraductal disease present. Now, what does this mean? So as we look at this, I'm going to zoom in on the top one here. This sample was taken from the right mid portion of the prostate, and it does identify that there was what we call prostate adenocarcinoma, or Gleason 6 prostate cancer. The thing that I like to point out here is that it's the Gleason score is 3+3, meaning 6, and that puts it into a category called a grade group. The next video in this series will go through the whole risk stratification. So if you're reading through your report right now and you see that you are Gleason 6 or grade group 1, I would just write that down. And then it says that there was one of the 2 samples involved, and it involved 5% of the total sample, or 5% of the total parenchyma. Then the next sample of interest was the suspicious lesion that was found on MRI, and in this patient, fake patient, they had that lesion specifically targeted. And so for this patient, for the prostate adenocarcinoma, they have Gleason 4+3 equals 7, and that puts them in a category called grade group 3. And so if I was this patient, I was going through this report, I'm going to write down I have grade group 1, I have grade group 3 prostate cancer in 2 areas, or really these could correspond to 1 area, and then I will know that on a scale of 1 to 5, grade group 1 is the lowest, and grade group 3 is kind of middle of the road on that scale of 1 to 5. This is part of the Gleason pattern scoring system for prostate cancer. It's a somewhat confusing pattern. 3 is the lowest risk, 5 is the highest risk, and what the pattern scoring system does is it takes the most prevalent and adds it to the highest risk disease in that area, and adds the 2 scores to give it a score of, in this case, 7. So 4 was the most common, so it's 50% of pattern 4. 3 was less common, so about 50% pattern 3, and therefore it ended up with a Gleason score of 4+3 equals 7. When we put these things together, we think it's a little bit easier to communicate about these results when we put them into the grade group system. The next video will go over the risk stratification of the grade group system. However, as you can see here, Gleason 6 disease, as is indicated on top, is grade group 1, or it's actually the lowest risk. Gleason 3+4 disease is different than Gleason 4+3, even though both equal 7. 3+4 disease is in grade group 2, 4+3 disease is in grade group 3, The reason why is because in 4+3 disease, the pattern 4, or the more aggressive pattern within the prostate, is more common there, and therefore it gets a higher grade group. And then 4+4, which is pattern 8, and 4+5 and 5+5 are all in the high risk setting. And so those are grade group 4 and 5. This becomes confusing because the MRI system is also presented on a scale of 1 to 5. It's PI-RADS 1, 2, 3, 4, and 5, where PI-RADS 3, 4, and 5 are the lesions that we typically are concerned about in biopsy. And so this is just to point out that the grade group system is separate from the PI-RADS system. I hope this helped, and I would recommend watching the next video on risk stratification to figure out where you stand and where your options are. Thanks.